Foods, a powerful weapon against cancer. When it comes to preventing and supporting cancer treatment, many people often look for a superfood that can cure the disease. However, the truth is that there is no magical food that can single-handedly destroy cancer. What truly makes a difference is the overall combination of many different foods in a healthy and balanced diet. Food not only nourishes the body but also plays a crucial role in reducing the risk of cancer development and preventing its recurrence after treatment. Smart food choices in daily meals can boost immunity, improve the immune system, and help eliminate abnormal cells. One of the foundational principles that experts recommend is a plant-forward eating approach, a diet that prioritizes plant-based foods. This doesn't mean you have to completely eliminate animal products, but the majority of your meals should consist of vegetables, fruits, legumes, seeds, whole grains, and herbs. These are rich sources of antioxidants, fiber, vitamins, and minerals that help the body combat inflammation and prevent the development of cancer cells. In addition, this diet helps maintain a healthy weight, an important factor in cancer prevention. A healthy nutritional lifestyle combined with regular exercise not only supports recovery after treatment, but also acts as a long-term protective barrier for the body. Remember, eating is part of the treatment and prevention process, and each meal is an opportunity to care for your health, nourish your body, and live stronger every day. Here are 12 foods that help fight cancer cells. Stay tuned. If you find these insights helpful, don't forget to subscribe to the channel to not miss important health information for yourself and your loved ones. Every week, the channel will send you reliable, easy to understand, and approachable medical information, helping you live healthily, proactively, and with better quality every day. Let's spread a healthy lifestyle and disease prevention from the root. Suwasanas are amygdala berries, small fruit, big power in cancer prevention. In the journey to building a healthy lifestyle to prevent cancer, berries, small fruits, are one of the first foods recommended to include in your daily diet. Despite their small-sized fruits like blueberries, raspberries, strawberries, and blackberries are packed with valuable nutrients that can help the body prevent and fight cancer cells. Berries are known for their exceptionally high levels of antioxidants, especially anthocyanins, flavonoids, and polyphenols. These substances help neutralize free radicals, slowing down cell damage and reducing the risk of cancer cell formation. Moreover, the abundant vitamin C in berries plays a crucial role in boosting the immune system and aiding recovery after treatment. Not only that, berries are also an excellent source of fiber, which helps maintain a healthy digestive system, control blood sugar, and support weight management, a key factor in preventing cancer recurrence. In the Cancer Freedom Recovery Program, increasing berries is the first change that nutritionists apply to patients. This is because it's a simple, easy-to-implement change that brings long-term benefits. Incorporating berries into your diet not only improves nutritional quality, but also boosts the morale of patients. You can consume fresh berries, but if they are hard to find or out of season, frozen berries are still an excellent choice, retaining most of their nutrients. You can use them in smoothies, mix with yogurt, top oatmeal, or simply enjoy them as a healthy snack. Remember, don't wait until you have cancer to pay attention to nutrition. Actively adding berries to your daily diet is a practical way to protect your body from cancer risks right now. With citrus fruits, natural source of vitamin C to help recovery after cancer. After undergoing cancer treatments such as surgery, chemotherapy, or radiation, the body often becomes weakened and suffers from a severe lack of antioxidants. This is when smart nutritional supplementation can make a big difference. And citrus fruits are one of the top choices. Oranges, lemons, mandarins, and grapefruits are all common fruits, but have the natural ability to boost the immune system due to their high vitamin C content. Vitamin C is not only a powerful antioxidant, but it also helps stimulate white blood cell production, protecting the body against bacteria, viruses, and especially abnormal cells like cancer. Moreover, vitamin C supports tissue regeneration and accelerates wound healing, which is crucial for those who have just undergone cancer treatment. When combined with a diet rich in vegetables and other fruits, citrus fruits help restore the body's oxidative balance, thereby reducing the risk of cancer recurrence. In Dr. Amy's shared video, She emphasizes that citrus fruits are a treasure that helps the body recharge energy and resistance, especially for those who have gone through prolonged oxidative stress before, during, and after treatment. Simple habits such as drinking warm lemon water in the morning, eating an orange every day, or adding a few slices of grapefruit to a salad can make a big difference in cancer prevention. Notably, studies have shown that vitamin C in citrus fruits is particularly helpful in preventing cancers like stomach, esophageal, and colorectal cancers, types closely linked to oxidative processes. Adding a few segments of orange or a cup of lemon water every day is not only simple, but also an effective first step to proactively protect long-term health. Citrus fruits. Simple, natural, and reliable. Garlic and tomatoes. A simple duo to fight cancer cells. In the journey of building a diet that supports cancer prevention, there are two easily available and simple-to-use foods that offer significant benefits. Garlic and tomatoes. Garlic, a small spice with big benefits. Garlic is not just a flavor enhancer in dishes. It is also a source of organosulfur compounds which have been shown to reduce the risk of developing certain types of cancer. The sulfur compounds in garlic help promote the process of apoptosis, cell death, in cancer cells, as well as inhibit the growth and duplication of abnormal cells. What makes garlic particularly special is how easily it can be incorporated into daily meals. You can use garlic to saute vegetables, season soups, or combine it with tomatoes and sauces, both enhancing flavor and boosting health benefits. Garlic can also be consumed raw or lightly roasted to retain many of its beneficial compounds. Tomatoes, a natural weapon against cancer. Tomatoes are a must-mention when discussing foods rich in antioxidants. Tomatoes are high in lycopene, a powerful antioxidant that helps protect cells from the damage caused by free radicals, which are a major cause of cell mutations and cancer formation. Lycopene is especially useful in reducing the risk of cancers, such as prostate, lung, and stomach cancer. Interestingly, lycopene is better absorbed by the body when tomatoes are cooked, such as in tomato sauces, tomato soup, or stews. The combination of garlic and tomatoes not only makes for a delicious meal, but also serves as a golden duo to help prevent cancer effectively. A simple tomato sauce with garlic paired with vegetables and whole grains is an ideal choice for anyone wanting to start a healthy eating routine. Cruciferous vegetables. Green. Foods that effectively help prevent cancer. No healthy diet is complete without cruciferous vegetables, a group of plants that are both familiar and packed with nutrients that can help reduce the risk of common cancers. Vegetables in this group include broccoli, cauliflower, kale, Brussels sprouts, bok choy, and others. Fiber, the first line of defense against cancer. One of the standout features of cruciferous vegetables is their high fiber content. Fiber helps improve digestion, supports the elimination of toxins from the body, and nourishes a healthy gut microbiome, a factor increasingly recognized in cancer prevention, especially colorectal cancer. Additionally, a fiber-rich diet is linked to reducing chronic inflammation and balancing hormones, which in turn helps prevent breast cancer, uterine cancer, prostate cancer, and many other conditions. Glucosinolate, a powerful plant compound. What makes cruciferous vegetables special is that they contain glucosinolates, a natural compound that when digested is converted into active substances that can inhibit the growth of cancer cells, slow down the division of abnormal cells, and help the body eliminate damaged cells. Studies show that glucosinolates may contribute to reducing the risk of lung, stomach, colon, and breast cancer. Notably, the effectiveness of these compounds is enhanced when the vegetables are steamed or eaten raw, depending on the type of vegetable. Simple, easy to prepare, and extremely beneficial. Cruciferous vegetables are easy to prepare. You can steam, boil, saute lightly with olive oil, or make salads with a light dressing. They can also be incorporated into soups, stews, or green smoothies. If you are looking to increase your vegetable intake to naturally prevent cancer, cruciferous vegetables are a top choice. Try starting by adding 1 portion of cruciferous vegetables to each meal. Simple yet highly effective in the long term. Leafy greens, nutritional shields against cancer cells. In the journey of building a healthy diet and preventing cancer, leafy greens play an important and irreplaceable role. Vegetables like spinach, Swiss chard kale, and others are not only common in daily meals, but also provide essential nutrients for a strong body and immune system. Natural vitamin C to boost immunity. Leafy greens are a rich source of vitamin C, a powerful antioxidant that helps neutralize free radicals, agents that can damage cells and lead to cancer cell formation. Especially for those who have undergone cancer treatments such as chemotherapy or radiation, which deplete the immune system, and natural antioxidants, adding leafy greens to the daily diet, can help restore immune function and reduce the risk of recurrence. Fiber helps detoxify the body and balance hormones. Another major benefit of leafy greens is their high fiber content, which aids digestion, prevents constipation, and helps eliminate toxins and excess estrogen from the body. An important factor in preventing hormone-related cancers such as breast or uterine cancer. A high-fiber diet has also been shown to be linked to a lower risk of colorectal cancer and improved gut health. The foundation for an effective immune system. Boost antioxidants and support detoxification. In addition to vitamin C and fiber, leafy greens also contain carotenoids and flavonoids, plant compounds that have natural anti-inflammatory and anti-cancer properties. These compounds help the body detect and destroy abnormal cells early, while also supporting the liver in its detoxification process, thereby reducing the oxidative burden on the entire body. Shakshawina. Watch Shabaka conclusion. To reduce the risk of cancer and protect long-term health, you should make it a habit to include leafy greens in your daily diet, ideally 1 to 2 servings per meal, whether cooked or used in salads or smoothies. Simply incorporating leafy greens into your meals is a step closer to a healthy cancer-free body. Green tea, the silent warrior in the fight against cancer. Among the list of foods that support the fight against cancer cells, green tea is highly regarded for its rich content of valuable plant compounds with powerful antioxidant and anti-inflammatory properties. Not only does green tea help reduce the risk of cancer, but it is also very beneficial in the recovery process after treatment. Rich in flavonoids, strong antioxidants. Green tea contains high levels of flavonoids and catechins, especially epigallocatechin, gallate, EGCG, one of the strongest antioxidants capable of blocking the development and division of cancer cells. Many studies have shown that regular consumption of green tea can help reduce the risk of breast cancer, prostate cancer, colorectal cancer, and stomach cancer. Supports improvement of chemobrain. After treatment. For many cancer patients, one common side effect after treatment is chemobrain, a condition involving loss of concentration, memory problems, and difficulty thinking or recalling information. Green tea, with its ability to improve brain circulation and provide antioxidant compounds, can help alleviate these symptoms. Adding 1–2 cups of green tea per day not only provides a mild alertness, but also contributes to better brain function. Supports reducing inflammation and regulating immunity. In addition to its antioxidant properties, green tea has natural anti-inflammatory effects. Regular consumption of green tea can help soothe chronic inflammatory responses in the body, a key factor believed to underlie many types of cancer. Moreover, green tea's impact on immune regulation is also significant. A healthy immune system is the body's natural defense to recognize and eliminate cancer cells before they grow. Note it's best to consume green tea without sugar, and avoid drinking it at night if you are sensitive to caffeine. Alternatively, decaffeinated green tea can be chosen if consumed in the afternoon or evening, while still enjoying its nutritional benefits. Nuts and seeds, small but powerful in fighting cancer. Although small in size, nuts and seeds are a highly nutritious source packed with components that protect the body from the risk of cancer and assist in recovery after treatment. Known for their high content of healthy fats, fiber, vitamins, minerals, and antioxidants, nuts such as almonds, walnuts, pumpkin seeds, flax seeds, and chia seeds should be included in the diet of those concerned about long-term health. Source of healthy fats and anti-inflammatory properties. Nuts and seeds are rich in omega-3 and omega-6 fatty acids, which help reduce inflammation and improve cellular function. Chronic inflammation is one of the underlying factors driving the development of cancer cells, so controlling inflammation through nutrition is crucial. Particularly walnuts and flax seeds have been studied for their ability to reduce the risk of breast cancer and colorectal cancer due to their plant compounds like lignans and alpha-linolenic acid, ALA, rich in fiber and help control weight. The fiber in nuts not only helps improve digestion and boost gut health, but also assists in controlling blood sugar and providing longer-lasting satiety, important factors in maintaining a healthy weight after cancer treatment. In fact, uncontrolled weight gain after chemotherapy is a common issue among patients, directly impacting the risk of recurrence. Therefore, consuming nuts and seeds in moderation will provide essential nutrients without contributing to excess calorie intake. Effective ways to use. You can sprinkle some nuts on yogurt, smoothies, salads, or oatmeal. However, be mindful of portion control. Aim for about a small handful, 15-30 grain, each day to avoid excess calories. Tip: prioritize using unsalted, unflavored nuts to ensure the nutrients remain intact without adding extra salt to your daily intake. Fatty fish, a natural omega-3 source, helps reduce cancer risk. In cancer prevention diets, fatty fish is a group of foods highly recommended by nutrition experts due to its high omega-3 fatty acids, high-quality protein, and micronutrients that support immunity. Fish like salmon, mackerel, and sardines not only benefit cardiovascular health, but also protect the body from the development of cancer cells. Omega-3, a natural anti-inflammatory fighting abnormal cells. Omega-3s have the ability to reduce systemic inflammation, thereby lowering the risk of cellular mutations and the formation of malignant tumors. Notably, many studies have shown that consuming fatty fish regularly can reduce the risk of breast cancer, prostate cancer, and colorectal cancer. Unlike the saturated fats that cause inflammation found in processed foods, omega-3s help stabilize cell membranes, regulate hormones, and support the natural process of apoptosis, a mechanism the body uses to eliminate damaged cells, including cancerous ones. A golden factor in the Mediterranean diet. Fatty fish is an essential component of the Mediterranean diet, which is considered one of the healthiest diets for reducing the risk of cancer and chronic diseases. Unlike strict restrictive diets like keto or carnivore, the Mediterranean diet is rich in plants but also includes high-quality protein sources from fish and seafood, especially omega-3 rich fatty fish. How to incorporate fatty fish into your diet? Start by eating fatty fish at least once a week and gradually increase to 2 to 3 times a week depending on nutritional needs. Fish can be prepared by baking lightly, pan frying, or steaming with vegetables to retain flavor and nutritional value. Additionally, if you find it difficult to eat fresh fish frequently, omega-3 fish oil supplements can also be an option, but be sure to consult with your doctor before using them. Note: prioritize choosing wild-caught or organic fish and limit farmed fish that may contain heavy metals or chemicals that accumulate over time. Legumes and lentils, rich in fiber and antioxidants. Legumes and lentils are foods rich in fiber, plant-based protein, vitamins and minerals especially beneficial for reducing the risk of cancer. These include black beans, lentils, green beans, white beans, chickpeas, and many others that can easily be incorporated into your daily diet. Rich in fiber, reducing the risk of colorectal cancer. One of the key reasons legumes and lentils are beneficial for health is their high fiber content, especially soluble fiber helps reduce the risk of colorectal cancer by supporting the digestive system, enhancing food transit through the intestines, and minimizing the exposure of intestinal cells to potential carcinogens that may form during digestion. Numerous studies have shown that a fiber-rich diet is linked to lower colorectal cancer rates in countries that consume plenty of vegetables and legumes, contain special anti-cancer compounds. In addition to fiber, legumes and lentils also contain many plant compounds with antioxidant and anti-inflammatory properties. Studies have shown that these compounds help slow the development of cancer cells, particularly in breast cancer and colorectal cancer. Lentils and black beans are especially rich in flavonoids and saponins, two powerful antioxidants that help block the formation of cancer cells. Incorporating into daily diet. You can easily add legumes and lentils to your daily meals in many forms, such as lentil soup, bean salads, or simply cooking beans with rice or stews. Legumes and lentils not only provide plant-based protein, but are also an ideal choice to replace animal protein sources in the diet to reduce unhealthy animal fats. To get the maximum benefit, aim to add 2 to 3 servings of legumes per week into your menu note. While legumes and lentils are highly beneficial, some people may experience digestive issues due to their oligosaccharides, indigestible carbohydrates. However, soaking and cooking them thoroughly can help reduce these issues. Whole grains, rich in fiber, vitamins and minerals to support cancer prevention. Whole grains, including oats, brown rice, quinoa, barley, and whole wheat, are essential foods in a diet designed to prevent cancer. Whole grains are not only a source of fiber, but also provide B vitamins, vitamin E, iron, magnesium, and other minerals that are vital for the body, rich in fiber. Promotes colon health. One of the main strengths of whole grains is their high fiber content. Fiber helps improve digestive health, reducing the risk of gastrointestinal diseases, especially colorectal cancer. Studies have shown that a fiber-rich diet can reduce the risk of colorectal cancer by 20–30%. In addition, fiber also helps lower cholesterol, control blood sugar levels, and maintain a healthy weight, all of which are crucial factors in cancer prevention. Contains anti-cancer compounds. Whole grains also contain several antioxidants, such as lignans and phenolic acids that can reduce the growth of cancer cells. Research has shown that these compounds help counteract the formation of cancer cells by reducing oxidative damage and inflammation in the body. In particular, these compounds may help lower the risk of breast cancer, colorectal cancer, and lung cancer. A healthy alternative to refined grains. In a healthy diet, replacing refined grains like white bread and white rice with whole grains is a crucial step in reducing the risk of cancer. Refined grains are stripped of their husk and germ, causing them to lose most of their fiber and nutrients. Therefore, choosing whole grains allows you to take full advantage of the nutritional benefits of these foods. How to incorporate whole grains into your diet? You can easily add whole grains to your daily meals with dishes such as oatmeal quinoa, salad brown rice, or whole wheat bread. Additionally, try combining whole grains with vegetables to create a nutritious, cancer-preventing meal. Note: when replacing refined grains with whole grains, it's best to do so gradually to allow your body time to adjust to the increased fiber intake. Turmeric, a powerful anti-inflammatory and anti-cancer agent. Turmeric, with its active ingredient curcumin, is known for its powerful anti-inflammatory and antioxidant properties. Curcumin in turmeric can inhibit the growth of cancer cells and minimize the spread of cancer throughout the body, helping to protect against various types of cancer. Anti-inflammatory and antioxidant properties. Curcumin in turmeric is a potent anti-inflammatory agent. Chronic inflammation is a major risk factor for the development of many cancers, including breast, colorectal, and liver cancer. Curcumin can suppress inflammatory factors in the body, reducing the risk of chronic inflammation and thereby effectively preventing cancer. Additionally, curcumin is a strong antioxidant that helps protect cells from damage caused by free radicals. Free radicals can cause DNA damage and increase the risk of cancer. By reducing the accumulation of free radicals, turmeric helps maintain overall health and protects against cancerous cells. Prevents the growth of cancer cells. One of the most notable benefits of curcumin is its ability to prevent the growth of cancer cells. Studies have shown that curcumin can inhibit the formation of new blood vessels, which prevents tumors from getting the necessary blood supply to grow and spread. Curcumin can also help reduce tumor size and slow the spread of cancer cells. Precautions when using turmeric. While turmeric is very beneficial, it's important to note that curcumin has poor absorption in the body. To enhance its effectiveness, you can combine turmeric with black pepper as piperine. In black pepper greatly improves the absorption of curcumin. Additionally, you can use turmeric powder in dishes, smoothies, turmeric tea, or take curcumin capsules for supplementation. Be careful with tamoxifen users. However, turmeric or curcumin may not always be suitable for all cancer patients, particularly those who are taking tamoxifen, a drug used in breast cancer treatment. Curcumin can interact with this medication and reduce its effectiveness. Therefore, if you are taking tamoxifen, consult your doctor before using turmeric. Note: turmeric can be a wonderful addition to a cancer-preventing diet, but it should be used in moderation and under the supervision of a professional. Cancer prevention is not just about avoiding exposure to harmful agents, but also about building a healthy and balanced diet. Foods such as green tea nuts and seeds, fatty fish legumes, whole grains, and turmeric not only provide essential nutrients, but also play a vital role in protecting the body against the development of cancer cells. With their powerful antioxidant, anti-inflammatory properties, and ability to enhance immune function, these foods can help reduce the risk of cancer, support treatment processes, and aid in recovery after cancer treatment. However, a cancer prevention diet should be combined with other factors such as maintaining a healthy lifestyle, regular exercise, and avoiding harmful habits like smoking and excessive alcohol consumption. While nutrition plays an important role in protecting health, we must remember that every body is unique and requires special care and attention. Consulting with doctors or nutrition experts before making significant changes to your diet is essential. Let's work together to build a healthy lifestyle to safeguard our health and minimize the risk of cancer in the future.